Hi, good afternoon, Erie County. My name is Gail Burstein. I'm the Erie County Commissioner of Health. I am here solo today. My live stream buddy, Mark Polengars, our county executive, is not going to be joining us this afternoon. He's already done some extensive media debuts this morning, and he's going to be also talking with the media later this evening, so it'll just be me today. So first, just want to let you know, remind you about important provisos, that the information that we are presenting right now is current and only as of about a half hour ago. So, and this is a rapidly changing situation, so anything we may say now may not be true by the end of this presentation because everything is quickly changing. So if you want the latest update, go to our Erie County website, our COVID-19 website at www.erie.gov/COVID-19. So now I'm going to be talking about the numbers. So far, I'm in Erie County. As of this morning, there were 4,982 positive cases out of a total of 32,028 tests had been done so far in Erie County. And of those, unfortunately, 421 people have died. So again, we want to reach out to the families and friends and give our most sincere condolences. I just want to remind people that these are all laboratory confirmed COVID-19 cases. There's nothing presumed positive in these data. And then as of May 16th, there were 172 individuals who were admitted to Erie County hospitals for COVID-19. Of those, 47 were in the intensive care unit and 32 were receiving some type of airway assistance. So this is the map of looking at our Erie County COVID-19 hospitalizations in blue. And our a number of people that were admitted and are admitted to the intensive care unit in our hospitals in red, and the number of people receiving airway assistance in green. And then on the bottom, in the purple line, is looking at the number of deaths associated with COVID-19 in the hospitals. So you can see that overall, the good news and why we are starting tomorrow, reopening to at least just to phase 1, so limited opening tomorrow, because we have been successful of decreasing our total hospital admissions and our ICU admissions and people who are receiving any type of airway assistance. So again, that's because of people in the community being successful in social distancing, wearing masks, and washing their hands. And this number can change, and we would unfortunately be able to pull back on the phase 1 at any time if these numbers start to increase. So we have to continue what we need to do to keep these numbers down. And then the next slide is looking at the total testing done in Erie County for COVID-19 by week, starting with the week of March 14th and then ending with this past week, ending on May 16th. So you can see in the blue and the yellow combination are the total number of COVID-19 diagnostic tests. So those are the nose swabs, the polymerase chain reaction tests that have been done in the county by week. And then the pink tips are the total numbers that have been positive. So you can see we are heading in the right direction in terms of number of testing being done. So you can see last week there were about 9,000 tests that were done among Erie County residents. So that's good. We're getting our numbers, testing numbers up. And then at the same time, our proportion of positives are going down and our total numbers are going down. So last week, only 8% of all the testing done in Erie County for diagnostic testing was positive. So that's a good thing. So again, we have to keep that up. Even when we're in phase 1, we have to keep doing our social distancing, wearing masks, and hand washing. So these are data looking at the antibody testing that have been done in Erie County. So remember, whereas the diagnostic testing, the PCR testing, is looking at who is positive, who is actively infected at any one point in time, the antibody testing is helping us take a look back and seeing of what proportion of people in our community that were tested may have had an infection in the past, whether they were symptomatic or not. So as of the end of last week, there have been a total of 26,018 antibody tests done among Erie County residents, and of those, about 7.7% have been positive. So that still, remember, this is a very small slice of the pie. It's only about 11% of our Erie County population has been tested with antibody testing, but of those, of under 8% of the population looks like has been exposed. So that reminds us that there are still a lot of people in the community that haven't been exposed, don't have antibodies. We're not sure whether they protect people or not, or if they do, for how long they protect them, but there's still a lot of susceptible people in the community, so we still have to continue with the social distancing, the masking, and the hand washing, even when we start into phase 1 tomorrow. So, going to talk about how Erie County is responding. So the good news is, starting tomorrow, we are launching our antibody testing program. So that is going to be available for all Erie County residents who are aged 11 and older. These are going to be scheduled visits, and so we're going to need people to call and make an appointment. They're going to be taken on a first come, first served basis. So we're going to be rotating these clinics throughout the county. So by the end of 4 weeks' time, there will have been a clinic near you. We're releasing the information about open clinics at a week at a time. So as of today, we have clinics that are going to be open to schedule for Tuesday, Thursday, and Saturday, and then that will continue rotating as we finish a clinic. We'll open up a new clinic for a week in advance. So again, we're always going to be scheduling for 3 clinics, under a week out during each week. And again, it's a first come, first served basis. So the way that if you want to get an appointment for a COVID-19 antibody test, again, you would call our hotline at 716-858-2929. And remember, only individuals who have a scheduled appointment, and if they're under 18 years, they have to be accompanied by their parent or a guardian, will allow to be in the testing area. So there are going to be no walk-in appointments here. Everybody has to be scheduled in order to get a test. We're also going to require that people have some type of facial covering, either a mask, like some type of cloth covering, or a procedure mask, something to cover their face to protect everybody in the facility. The results will be mailed to everybody who is tested. You should expect to receive them in 7 to 10 days. And if you have questions about what your results mean, we encourage you to call your healthcare provider and discuss that with your health provider. We can't give you any specific advice on your own healthcare condition. So, sometimes people are confused, what's the difference between the PCR test, the diagnostic test with a nose swab, versus the antibody test that is a blood draw. So let me try to make it clear so there won't be any confusion. So the diagnostic test, which is the polymerase chain reaction test, is a test that people mostly get from a nose swab. So the results mean that at that point in time, when you had that specimen collected, you had either the viral DNA or RNA in your nose, and we assume that's because you have an active infection and you're shedding virus and you could be contagious to other people. So that's why we want anybody who has one of these tests that are positive, one of these diagnostic tests that are positive, that they have to put themselves in isolation, and as the county, somebody from the health department will call you and make sure that you understand what these isolation orders are. They are actually legal commissioner's orders, so everybody that has a positive diagnostic test has to be in isolation, and then our contact tracers will talk to that person that had a positive test, find out who their contacts were at home. If people are working, we want to know those contacts and make sure that those people are notified and that they are placed in quarantine, and strongly encouraged to get their own swab test, their own PCR test, to find out if they are also infected. Whereas the antibody test is different. So that is a test where we have to draw your blood. So, we have to look at your arm and get a vein and draw a small amount of blood, but it does require a needle stick. So that result means that sometime in the past, you were exposed to COVID-19, likely infected, and you mounted an antibody response that this test is detecting. Usually, most people develop a good level of antibody testing, antibodies that can be detected by testing after 3 weeks. So if you had symptoms in the past 1 to 2 weeks, it's probably too soon to get an antibody test. You really should wait at least 3 weeks after the onset of symptoms to get an antibody test to look for antibodies after an infection. So again, the positive antibody test does not mean that you have a current infection. It means that we're doing, the antibody test that we're doing is looking for a past infection. However, no test is perfect, so there's always going to be false positives, false negatives. So if you go out somewhere in the community and have an antibody test, you want to make sure that an FDA-approved test is being used. Because we know on the market now there are tests that have not been approved by the FDA and do not perform well. So you just want to make sure that if you're going to go to the trouble of getting this test and maybe having it paid for, that you make sure that you're using an FDA-approved test. Again, if you want an antibody test from the health department, call the same number, 716-858-2929. And if you want, this is for diagnostic testing. If you want that test, again, call 858-2929. And that's for, anybody who believe that they may have been exposed to COVID-19, they may have been infected, if they have symptoms, if they're an essential employee, even if they don't have symptoms and they think that for some reason that they may be at risk of COVID-19, you can get it tested by one of the Erie County Health Department's COVID-19 testing sites. You don't need a doctor's order, but you do need to make an appointment. We are not taking walk-ins for this clinic. So again, we're going to have clinics available throughout Erie County. So hopefully there'll be a test site near you. We do have a foreign language interpretation available if that is needed. So there are other great testing sites for diagnostic testing throughout Erie County. So if you can't get to one of our sites, Kaleida, one of our great partners for testing, has sites available. They have a site at the Leroy R. Coles Junior Library on East Delavan Avenue. That's open Monday, Wednesday, and Friday from 9 to 5. Again, that's also by appointment only. They prefer that you get a lab order from your primary care provider. It's really important, like just any other laboratory test you get, you loop in your healthcare provider and get an order from your healthcare provider to get that test done. It's because then your healthcare provider, really wants to know what's going on with your health, and so looping them in that you are worried that you might be at risk, and then looping them in with what the results are and how to take care of yourself and manage yourself is really important, just like any other laboratory test that you get. However, at this site with Kaleida, if you don't have a primary care provider, they're still able to do the testing at this site. And this is a site is really targeted for people at our zip codes in the city where we know that there's a lot of health disparities, and we just want to make sure that testing is available and accessible for those individuals. Kaleida, again, our great partner, also has testing locations throughout Erie County, in the suburbs and in the city. Again, it's by appointment only, so it's easiest if you have internet access and can get on your phone or a laptop. If you go to their website to make an appointment and then select COVID-19 testing. If you don't have that available, you can call their number at 716-859-3222. Again, it's 716-859-3222. So, and then our New York State Health Department is also a great partner in testing. They have a testing site available in the Cobblestone district on Perry Street, and they are offering testing for close contacts to cases, essential employees like healthcare workers or nursing home employees or first responders, or any essential employee that interacts with the public. Again, this is by appointment only, so you would call the New York State Health Department's COVID-19 hotline at 888-364-3737. 3065, and to schedule an appointment. You don't need a physician's order to get that appointment at the New York State Health Department site. And then our partners at Jericho Road also has community testing available, so they're not only testing their patients of their Jericho Road clinic, they are also offering free testing to the community. So the schedule is up here on the board. They have actually a clinic tomorrow at their Jericho Road on Barton Street site, and then the following day at their 8 Days of Hope site, and then the day after that at their Jericho Road on Broadway site. So to make an appointment, you should either go to their website or dial 716-881-6191. Again, for these specific testing clinics, you don't have to be a patient of Jericho Road. They would like to see your insurance, and if you have it, if not, you don't need insurance, and also you don't need to have any type of lab order for from your healthcare provider, or you don't need to make an appointment. It can be a walk-in. The tests are administered at the provider's discretion, first come, first serve. They would like you to be wearing a mask if you have that available, and then also to keep everybody safe, and also bring a photo ID and your insurance card if you have one. And then other testing available in the community is through ECMC. We have some great partners in our community that they're collaborating with to help them get testing on board. And so you can see there are many different primary care offices throughout Erie County, in the city and in the suburbs, that are offering COVID-19 testing. So if you want to schedule an appointment, you should contact that specific office and find out about when testing is available through those offices. So remember, the reason we are doing diagnostic testing is to identify people that are actively infected with COVID-19, put them in isolation, remove them from the community to make sure that they don't infect other people. So those individuals are subject to a commissioner's order to put them in isolation. So, the question is, who needs to be under a commissioner's orders when they get tested? So, people who go to get tested for COVID-19, if they are symptomatic, those commissioner's orders should start at the time of specimen collection, because if they're symptomatic, they could have COVID-19, or they could have some other infectious disease that could cause infection among other people. So anybody who goes for COVID-19 testing who is symptomatic, those commissioner's orders start at that time. People without symptoms, if they receive a positive test for diagnostic test for COVID-19, regardless if that's done by the county or one of our great testing partners, isolation starts at that time of that positive test result. So again, we're trying to remove people from the community and break the chain of community transmission. So people who do not need to be in isolation from the commissioner's orders are people who are asymptomatic, so they don't have any symptoms, and they go and get a COVID-19 diagnostic test. So at that time of testing, we don't know that they're infected with COVID-19 or anything else, so they do not have to be under isolation at that time of tested. However, if that individual becomes symptomatic, before they receive their test results, they should put themselves in isolation until they receive their test results and then act accordingly on that. And again, if you know that you're a close contact to somebody who has a COVID-19 test, you should make sure that you have placed yourself in quarantine. Hopefully that we'll find out about you from the person that was infected. If not, you should make sure that you place yourself in quarantine and to, again, remove yourself from community transmission. Remember, keeping our numbers down, keeping us in phase 1 of reopening, and hoping to, continue on that continuum so we can get to phase 2 and phase 3 and onward. But, again, we're only going to reach that unless we are able to continue to keep our numbers down, and that depends on you. We know that Governor announced today that there is going to be a reopening at the phase 1 level, according to New York State. So, businesses, if they are eligible to reopen tomorrow, or they're in a phase 2 or above reopening plan, may want to get prepared to, make a plan about how they can reopen safely. So we just want to make all those businesses aware of CDC guidance that is available free on the CVC's website, and that will help businesses be able to make a plan with disinfecting and how to make good social distancing practices included, and they have different recommendations for all different business types. So I recommend that you go to the CDC website and check out this great information that can help you, make it easy for you to put together your template and your plan to be able to be reopened whenever it is your time. So just want to let you know that, again, remind people that environmental health is continuing to forge ahead with property transfer inspections. So we are scheduling those inspections through people who have submitted applications. Right now, we are doing inspections on properties that have use a public water system and have a system on record. Now we are adding properties that are served by private wells that have a system on record, and then hopefully starting in the next week, we'll be able to also inspect systems of that are on private locations and do not have a system on record. So we're systematically opening up this inspections opportunity. Again, about 75% of the applications that received do meet the criteria, being on a public water system and having a system of record. And but the systems that are on private wells and that do not have a system on record are more complicated, and we have to figure out how to get into the home, or how to have these systems inspected that are inside the home. So we're working on that. However, we will get to you. And again, if people they feel that they can't wait, and if they have the resources, they can hire a private engineer to get that inspection done. And our $150 fee for us to review those inspection reports are waived. So again, we really want to help people get inspected as much as possible. We've completed over 100 inspections since we started opening up in the beginning of in April to do these inspections, and we're forging ahead. So please be patient. We're doing the best that we can. So it's though we're supposed to have warmer weather by the Memorial Day weekend, and the governor has announced that certain beaches can be open. State beaches, the governor announced are going to reopen. However, we just want to alert Erie County residents that Erie County beaches, which are Bennett Beach and Went Beach, will remain closed at least until June 1st. The Erie County parks will remain open with some restricted services, as we've described before, so that's the good news. So again, if people want to go to the Erie County parks, we encourage that. Fresh air and exercise is good. Just remember, please, if these parks get crowded in good weather, so please try to adhere to social distancing. It may be impossible to do that, so wear a mask. Please bring masks and wear masks when you're hiking through the park. And make sure that you bring hand sanitizer with you. If you touch anything in the park, please make sure to spritz your hands and get that hand sanitizer on to wash your hands as much as you can. Because we still have to rely on these basic tenets to keep our infection rates down, so we'll be able to stay in phase 1 and then forge ahead to the higher level phases and eventually reopen as best that we can in a COVID-19 climate. Another reminder, as the temperatures get warmer, the wildlife is out more, and we have more potential interactions with wildlife. And, rabies is still a thing, even though we're living in a COVID-19 environment. the wildlife is not always social distancing and putting people at risk for rabies in this COVID-19 era. So, rabies is continues to be a huge health threat during this COVID-19 era. And even just this weekend, there were 11 cases of people in Erie County residents who have had contact with raccoons. Even if you may see a raccoon, these animals, the raccoons and bats and skunks and foxes, in their brains they are programmed to stay away from humans. So if they seem interested in you, it's because there is something wrong with their brain. And if there's something wrong with their brain, it's because they have rabies. So instead of thinking of them as something cute to pet, think of them as something deadly that can kill you. So please stay away from the wildlife. Even though it looks cute and they think that they might be acting like they think that you're cute, they are deadly. So please stay away from them. If any of your family does come in contact with wildlife, please call the Erie County at 716-961-6800. That's our environmental health. We're on call 24/7 and alert them that you may have been exposed to wildlife. So again, even though we have not had any vaccine clinics this year for rabies, we still want to make sure that you work with your vet and keep your dogs and your cats immunized against rabies. Because remember, it is 100% deadly, and we have to respect the wildlife and don't go near the wildlife. And we have to protect our animals, so please keep them immunized. Because again, if our dogs and pets, our cats or ferrets get infected in our homes, then it puts us at risk of getting infected and our family members. So I just want to close that just to reinforce the importance of social distancing. So we are fortunate. We presented data today to show our numbers of positive tests are decreasing, numbers of people in the hospital are decreasing, number of people in the intensive care unit who are relying on some type of assisted ventilation are decreasing. So that's good, and it's because we have been affected with our social distancing. But COVID-19 is still here. That's not gone away. We've just been very smart in decreasing community transmission, and we have to continue to be smart in decreasing community transmission. Just because we're in phase 1 starting tomorrow doesn't mean that we can go out and have like full onboard parties, or this weekend, Memorial Day weekend, we can have these big like barbecues in our backyard and pool parties with all our neighbors. We have to continue social distancing. Masks have proven to be very effective in preventing transmission in our healthcare settings. So I just want to encourage people, when they're going out into the fresh air, even though it does decrease risk somewhat, it doesn't eliminate risk of COVID-19 transmission. So again, if you're going to go out to a state beach that's open, if you're going to go out to one of the county or state parks that are open, wear masks. Bring your mask. We have to protect ourselves as much as we can. Also, want to keep up the hand washing, disinfecting. If you touch something, even though it's like a tree or a rock in nature, doesn't mean that somebody else who might not have who have had COVID-19 could have touched it right before you or within the past 24 hours, and you could be infected with COVID-19 from touching something in the wild. So again, bring your hand sanitizers and wash your hands, especially your kids' hands if they touch something in the wild. Just because it's green doesn't mean that it's safe. So again, try to minimize the time that you spend in the public spaces, especially our elderly or people that have any type of chronic diseases that can make them more susceptible to becoming very, very ill with COVID-19. We want those individuals to stay away from public spaces. So again, we're all in this together, and we still have to continue working to minimize the chain of transmission, like break that chain of transmission in our community of Erie County. And that means, continue to wearing masks, continue to social distance, and continue to wash our hands, because COVID-19 is still here. That's not going away until we have a vaccine. So now I can open it up to questions from the media. To minimize the chain of transmission, like break that chain of transmission in our community of Erie County, and that means
continue to wearing masks, continue to social distance, and continue to wash our hands, because COVID-19 is still here. That's not going away until we have a vaccine. So now I can.
All right. Sorry, there was a bit of an echo issue. I think that's resolved. So I am going to start with a list of media that I have listed. So just to start, B News. Is anybody on from B News? Oh, you know what? I need everybody to stay on mute unless you're, I'm asking you a specific question, or else we continue to hear these echoes. So if the media can put themselves on mute, please. Should I put it on mute? Okay.
I have to take them all off mute in order to have them call in. Let's hope they're off.
Okay. I need everybody to stay on mute, please.
We continue to hear these echoes. So if the media can put themselves on mute, please.
Sorry about the technical difficulties. Do you want to put questions in from chat, or how do you want to do this?
Ask them to
email or Facebook chat.
So if you can email in your questions, or enter them into Facebook chat, that would be super helpful. Because I guess the open line isn't quite working today. And I will ask, I guess, Kara, are you receiving any questions?
let's have them email them in and we'll respond later.
Doc, what have you been doing when you haven't been here working?
So the question is, what have I been doing when I haven't been here working? Well, I've been working from home. I've been, with the days that I work from home, I'm able to take a nice walk through the neighborhood with my son, so that's been nice. But it's trying to spend time with my family. I'm very fortunate. My husband is a gastroenterologist, and he's also a great cook. So I've been eating these amazing dinners every night, and then the days when I'm home have been enjoying some great breakfasts and brunches. But it's we're really, everybody in Erie County is working very, very hard. So I've been doing a lot of late night working, and it's been a tough haul, but we're making progress. So I'm really happy that we're seeing some great outcomes to all the work that we've all been doing. But thank you for asking. It's really actually very sweet of you to care. Any other questions? Nope. Okay, so those are the questions that we've received. I just want to thank everybody for tuning in. And if you have any other questions, please, from the media, please contact Kara Kane, and we can answer those questions by email. So thanks, everybody, and stay safe. Wear your masks. They're actually another, fashion accessory.
Thanks for using.